Thank you for joining us today as you learn and as you go through our program on how to be a preceptor while working with nursing students in a clinical setting. There are many roles and responsibilities that nurses have to think about when they have a student nurse and are acting as a preceptor. One of them is that it's very, very important that we become very engaged with our student, and we help our student become engaged with the process of learning. Very, very important that we guide the student because they are basically fresh, they want direction, they want to learn, and so it's our job to make sure that we are guiding them down a path that they can take on into their nursing career. It's very, very important to be the example, and we should be a good example. We should be a role model for these students because we want them to be good nurses. So if we show them as an example that we are good nurses, they hopefully will emulate and copy that, and that's very, very important. So part of that is that you are the example. You're the person that they're going to look up to. And so it's very important that you as the preceptor, you also have a very inquiring attitude. You want to ask questions of your student as often as they are asking questions of you. You want to expose them to lots of different experiences so that they have an opportunity to learn as much as they can while they're in a learning environment and while you're there to help them along. And then as they work through the semester and as they work through their clinical experience and you teach them and you see them grow and you see them get better and better and better, before you send them off into their facility or into the world of nursing, you want to sit down with them and go over all of the things that they've learned and all of those good things that they have come to know and are going to take with them as they continue on to take care of patients. One of the things that we as professional nurses are responsible for when we're working with a student is to make sure that we lead by example. We want to be the role model for these students, and we want to be the very best and do the very best that we can. But we all know that we're not perfect and we don't know everything even in our own area. So it's really important to also share your colleagues and share other professionals that are on the floor with your student. So important for them to feel like they're part of the floor, and so to introduce them to the other people that they'll be working with, introduce them to the other departments that they might be working with. It increases their comfort level, and they are able to learn so much more when they feel comfortable in their environment. Watch for those opportunities for them because they might not tell you, or they might not be assertive enough to want to jump in and say, please pick me. So if you see an opportunity that would be beneficial for your student, send them off. Tell them, I think this would be good for you, and go ahead and let them experience those different experiences or those different opportunities. You set the bar. If you expect very little from your student, you will probably get very little from your student. So it's important to set the bar high. Tell them you want them to be wonderful, you want them to be great, and then provide them with those opportunities so that they can show that to you. One of the things that we as nurses have to do is we have to provide ongoing feedback to our student to make sure that they understand exactly what's going on. And it teaches them when they could do a little bit better, but it also praises them when they've done something really, really well. So it's very, very important that feedback be given sometimes right away, sometimes it can be done a little bit later, but it has to be done. This is not something that you can wait until the very end of the semester and then say, oh, by the way, 3 months ago I saw you doing this. So feedback it's not the evaluation, it's that immediate kind of very simple, concrete examples of this is what I saw you do, this is what I think you could do better, this is what you did really, really, really well. It needs to be, for the most part, in a private area, and when I say that, it doesn't necessarily have to be in a closed-off room, but it really needs to be away from the patient. Even if it's good feedback, you can do just kind of a general, that was good, and then leave the room. But when you're really going into the nitty-gritty of, you did this, and I saw you do this, and this was very good, and this is maybe next time you could improve a little bit on that, that is something that you do not want to do over the patient. So you want to take them to a corner of the nurse's station, take them to a private place in the hallway, or take them to the break room, which is fine, and sit down and have an honest conversation about what they did well and what they need to work on. Because again, these students are going to be off on their own very, very soon, and you want to make sure that they're very clear on what they need to do right, so that it just increases their opportunity for success. So as nurses, we have to remember that our ultimate responsibility is our patients, and that taking on a student adds to our workload. But it's always about patient care, and it's always about making sure that the patient is appropriately treated and cared for while they're under our eye. So we are teaching our students how to identify different things that are in our patients and different things to watch for in our patients. But we don't turf that off completely to the student, because that's not fair to the student, and it's also not fair to the patient. So it's still important that we identify the risks and certain procedures and certain things that a student can do very, very carefully and very safely to our patients. But sometimes we have to step in and we have to say, you know what? I need to take this and you can watch me. So it's not about just shoving everything off to your student because you want them to learn. You also have to manage all the risks that are involved in taking care of the patient. Again, we're an advocate for our students. We want them to do well, but we also are an advocate for our patients, and our ultimate responsibility is to take care of them with this added additional responsibility of providing a great learning environment for the student. As mentioned before, one of the most important things that we can do is assist our students into making different connections with different people, because we all have different levels of expertise in all different areas. I know that myself, when I think about my preceptor and the connections that she helped me make and the people that she introduced me to, it only enhanced my career once I got out on my own, because then I was more comfortable approaching people. So it's very, very important. You want to make them feel a part of the unit. And again, to reiterate that you need to introduce them to the doctors, introduce them to the other staff members, introduce them to the dietary people and the radiography people, because they're going to be coming in contact with your student, and you want them to feel like they're a part of the unit. They relax, and it just promotes more learning opportunities. Again, as mentioned before, to send them off into different directions, to send them off to see a procedure, to encourage that they view these things, even if it's not a nursing procedure in and of itself, to learn about what other departments are doing to their patients when they're off the floor is always beneficial to the nurse and to the patient when that comes up again. And when patients are fearful and when they're scared and when they look at the nurse and they say, what's going to happen to me down there? It's very comforting when the nurse can say, this is what they're going to do. And even though patients still stay scared, it reduces that anxiety a little bit, kind of knowing what's expected. When a nurse says, I don't know, I've never been down there, that doesn't help our patients in any way, shape, or form. So to facilitate those learning possibilities and those opportunities always benefits the student, always benefits you, because sometimes they'll come back and ask questions and actually enhance your own learning process. So both of this give and take kind of interaction that you have with your student really, really enhances and facilitates even more learning opportunities for both of you.